First, on behalf of the people of Hawaii, I want to thank you again. You were the manager of the measure that allowed us to name a post office after former Congressman C. Siftel. Thank you again for that. And I'd like to thank you, plus the members of this committee, for your unanimous consent to allowing me to participate. And Mr. Chair, one of the reasons why I asked to participate is because of the fact that the people of Hawaii were also very concerned about the reports of the money spent on our connector. And Mr. Matsuda, I do want to say up front that I know you've inherited this. The connector went into effect in 2011, July specifically, and you came on board in November. So to the extent that you can address some of these concerns, I'd appreciate it. First of all, one of the things that I think fundamentally we must all understand is Hawaii is truly different. I know everybody says that, but Hawaii is truly different. We're the only state that has the prepaid health care law that went into effect in 1974, and I think that's part of the issues that we have to understand as we look at these numbers. I saw the letter sent to the governor, and it speaks to $205 million going to the Hawaii connector, and I think they computed it out at about $44,000 per person. But let's begin there. So, Mr. Matsuda, $205 million, I think, was the grant that you were entitled to. How much money did the state actually use?
As of the end of this past calendar year, we've spent $57 million out of that amount.
And it's my understanding that there was a request to extend so that you could spend the remaining amount or however amount you could justify, but the state has been denied that. Is that correct?
The operations and maintenance portion of the grant cannot be used beyond this calendar year. That's correct.
So of the $205 million, so people understand us very clearly, how much money would either be returned to the federal government, or how much money, if you want to answer it that way, or how much money do you get to continue to use?
So in addition to the $57 million that's already been spent, we have obligated under contract an additional approximately $50 million. So that means we have about $100 million roughly of the federal grant money that has yet to be obligated or spent. The amount or the portion of that is related to operations and maintenance versus development money, which can be extended to next year, has yet to be determined. We're working with CMS to figure that out because we just got that decision recently. Obviously, we want to be careful about how we use taxpayer dollars. So the development money will be used just to the extent necessary to improve the system to fit our unique marketplace.
And what you have testified before the state legislature is that, and I think I misheard you speak earlier, is that the Hawaii connector cannot self-sustain in terms of, and if you base it purely on the amount of monies that are coming in terms of premium percentage of 2% or so. Was that correct?
Yes, that is what I testified to.
And I think that was in line with potentially a request to the Hawaii State Legislature for state funds of approximately $15 million a year to continue the connector. It may be less because of the number, but that was about the amount. Am I correct in that?
Well, yeah, actually, we're going through a process right now to figure out how we can reduce those expenses substantially below $15 million.
But so the state is aware that it has to kick in essence, to cover the continuing costs of the connector.
Yes, but I think it's important to put it into context. The issue for us on the revenue side is that because of the Prepaid Healthcare Act, virtually all small businesses in the state already have insurance for their employees, and so there's very little incentive for them to leave a system that they've been accustomed to for almost 40 years. And so I think it's incumbent on us, looking at that marketplace reality, to try to reduce the cost of the operations of our system as much as possible.
So if we can just go through this very quickly. So there's said to be 100,000 total uninsured in Hawaii, of which about 58, almost 60,000 are really going to be covered by Medicaid expansion. So the only number that can be enrolled is about 33,000. Is that about right? Because we have some that are ineligible because of immigration status.
Yes, that's right if you're only looking at the uninsured, but there are other people who currently have insurance that might be able to find better quality or lower cost insurance. through the exchange. So the potential on the individual marketplace is probably bigger than just the 33,000.
If I may, Mr. Chair, if I can just have a little bit of leeway here, if you don't mind.
Sure, I'll give you some of Mr. Conley's time.
Thank you. So, Mr. Matsuda, the thing that I really wanted to get to is quite candidly a level of frustration I've had with your predecessor and whoever was there. You know, I was not here when we voted the ACA. However, I do know that the ACA has an exemption for Hawaii. I think it's Section 1560, which was anticipated in the original law, because of our Prepaid Health Care Act. I've always asked, okay, what have you done, or what does it mean? And we have not gotten a response on that. I do also know that there is a movement in Hawaii that we avail ourselves of Section 1332 of the quote ACA, which is really an exemption from the provisions, and it's supposed to be because you have a, I guess for lack of a better description, it's called the, if I can find my section here, it's called the Waiver for State Innovation. And of course, we'd like to think that we were the major innovators in any kind of healthcare. So, but that doesn't kick in till 2017. So the question is, why haven't the state or you know, the connector looked at this? Because the problem is the fact that our prepaid health and the ACA are not meshing well. I mean, that's our problem. That's the reason why the connector doesn't work. That's the reason why we can't go on the federal system, because it doesn't take into account the uniqueness of Hawaii's law. Would you agree with me that that's your fundamental problem? That's the reason why it's not working.
That's correct, Congresswoman. And we are very anxious to take advantage of the innovation waiver in 2017, and in fact, we wish it would occur earlier.
But what about the exemption in the law itself that exists today, which is Section 1560? Why haven't we availed ourselves of that? Or is there a way that you can go to, you know, the Secretary of the Health and Human Services and say, you know, we've got this, or CMS, and say, we've got this waiver in the law, and we've got this waiver that we know you probably qualify us for in 2017. Why haven't we done that?
I'm not an expert on that section of the law, but my understanding is that it only refers to preserving the exemption that we have for prepaid under ERISA. But the scope of the ACA is much bigger than that and includes other areas of the law. So I think there's a complicated legal evaluation that needs to be made to see if we can take advantage of it in the way that you're suggesting.
And we haven't done that yet.
I do know that it's under consideration by both the legislature and the state administration, and we're trying to assist with that.
Thank you. And Mr. Matsuda, like I said, this is something that you inherited, but notwithstanding, you can imagine how people at home are very frustrated with this, and actually they're very embarrassed that people are saying we have all this money and we've only enrolled less than 8,000 people, but the enrollment of the less than 8,000 is really a function of the existing laws that we have that are not meshing. And I would really appreciate it if you would keep us apprised of that, because that's always been a question that we have constantly asked, or I've constantly asked, is why have an exemption in a law, not use it, and then have to wait till 2017 when we are clearly, I believe, the example that that provision, Section 1332, was intended to not have to address because we're exempted. But we are truly innovative. Wouldn't you agree?
Yes.
Thank you very much, and thank you, Mr. Chair.